Stop hobbling. 3 doctor-approved moves that cut morning heel pain in days. Today, I'll show seniors simple, safe, doctor-recommended fixes you can start doing right now to calm plantar fasciitis and walk pain-free. One of the most common signs of plantar fasciitis is a sharp, stabbing pain in the heel, especially with the very first steps in the morning. Many people also notice the discomfort after sitting for a long time, or when they suddenly stand up and begin walking. In some cases, the pain can return after extended periods of standing or after finishing exercise, even if it was not felt during the activity itself. Recognizing these familiar patterns is important because they help confirm that the heel pain is very likely linked to plantar fasciitis. By relating to these experiences, viewers can identify their own symptoms and understand that the upcoming solutions may be relevant to their condition. If the pain is new or worsening, there are safe first aid steps to take right away. The most important measure is relative rest, which means avoiding long walks, running, or prolonged standing that can further strain the plantar fascia. Applying ice to the affected area for 10 to 15 minutes at a time, several times per day, helps reduce inflammation and provide short-term relief. For those who are medically cleared, over-the-counter anti-inflammatory medications, such as ibuprofen or naproxen, may help ease discomfort. Gentle massage, such as rolling the foot over a frozen water bottle or a smooth ball, can also relax the tight fascia and improve blood flow. These simple but effective steps can begin to calm the pain within the first 2 to 3 days and prepare the foot for more targeted stretches and strengthening later. Stretching is one of the most effective and safest ways for seniors to ease plantar fasciitis pain and support recovery. 3 simple moves can make a big difference when practiced consistently. The first is the calf or Achilles stretch against a wall. Stand facing the wall, place both hands on it, step 1 foot back, and gently press the heel into the floor while keeping the knee straight. This helps lengthen the calf and Achilles tendon, both of which place stress on the plantar fascia when tight. Hold for 15 to 30 seconds and repeat 3 times on each leg. The second is the plantar fascia towel stretch. Sit on a chair, loop a towel or band around the ball of the foot, and gently pull it towards you while keeping the knee straight. This specifically targets the plantar fascia and reduces morning tightness. Again, hold for 15 to 30 seconds, 3 times on each foot. The third move is a rolling massage, where the sole of the foot is slowly rolled over a frozen water bottle or massage ball. This not only stretches the fascia, but also soothes pain through gentle pressure and cooling. Performing these 3 stretches twice daily can significantly reduce strain, improve flexibility, and help the fascia heal. While stretching reduces tension, strengthening is equally important to build resilience in the plantar fascia and surrounding tissues. A highly recommended exercise is the heel raise step progression. Stand on the edge of a step with the balls of both feet supported and heels hanging off. Slowly rise onto the toes, pause, then gradually lower the heels below the step. This eccentric movement focuses on controlled lowering, which has been shown to strengthen both the fascia and the Achilles tendon over time. For seniors, it is best to start with both feet and progress carefully. Aim for 3 sets of 10 to 15 repetitions every other day, taking breaks as needed. The key is slow, controlled motion rather than speed. Over weeks, this progressive loading builds tissue strength, improves support for the arch, and reduces the risk of pain returning. Combined with stretching, this single strengthening exercise forms the foundation of a long-term recovery plan for plantar fasciitis. What you wear on your feet throughout the day can make or break your recovery from plantar fasciitis. Seniors should swap out soft, unsupportive slippers or flat shoes for trainers or walking shoes that provide firm arch and heel support. Walking barefoot on hard floors should be avoided because it increases strain on the plantar fascia. Over-the-counter orthotic insoles or arch supports are also highly effective as they distribute pressure evenly and reduce stress on the heel. For those who experience severe morning pain, a night splint can be a game changer. By keeping the foot gently dorsiflexed overnight, the fascia remains stretched, reducing the painful stiffness many people feel upon getting out of bed. While most cases improve with consistent home treatment, there are situations where medical care is essential. If you experience a sudden sharp increase in pain, numbness, tingling, or symptoms that fail to improve, after 6 to 8 weeks of stretching and strengthening, it is time to consult a clinician. Seniors with diabetes or poor circulation should also be cautious and seek help earlier. Healthcare providers may recommend physical therapy to improve foot mechanics, corticosteroid injections to calm severe inflammation, or shockwave therapy for persistent cases. In rare and severe situations, surgery may be considered, but this is usually only after all other options have been exhausted. Here is a simple plan you can start right away. During days 1 to 3, focus on rest, icing, gentle rolling massage, and beginning the daily stretches twice a day. From day 4 to 7, add 1 strengthening session every other day. Switch to supportive shoes with orthotic inserts, and consider using a night splint if morning pain continues. If you notice steady improvement, stick with this routine. If pain persists or worsens, schedule an appointment with a clinician to explore further treatment options.